Hello everyone. For years, we kept hearing the same advice about weight loss. Just eat less and exercise more. And when that didn't work, many people tried everything else. Diet apps, gym memberships, weight loss classes, morning walks, eating healthy salads for days, sometimes even for months. But even after all that effort, the weighing scale barely moved, and now, after years of frustration, the world is looking at weight loss medicines with new hope. Two names are leading this new conversation: Semaglutide and Tirzepatide. Today, these medicines are reaching people through different brand names from many companies. Celebrities are talking about them, influencers are promoting them, and somehow, even someone who still eats burger and fries every evening has lost a surprising amount of weight. So, what changed so suddenly in the world of weight loss? Maybe you have also seen advertisements or social media posts about miracle weight loss injections and pills, and wondered, can these medicines really help people lose weight? Or are they simply another expensive shortcut wrapped in clever marketing? And the biggest question is, how do these medicines actually work? Because behind all the hype, there is a much bigger story. According to the World Health Organization, obesity rates are rising rapidly across the world. Obesity has become one of the biggest global health concerns of modern life. Obesity is not just about looks anymore. It can increase the risk of diabetes, heart disease, fatty liver, sleep problems, infertility, depression, and even chronic knee pain. Now let's understand. What exactly are weight loss medicines? These are prescription medicines, not ordinary supplements like vitamins. These medicines are recommended for people with obesity or other serious health risks and should be used under medical supervision. Before we explore how these medicines work, we first need to understand how the brain, stomach, and hormones work together to control hunger and cravings. After we eat food, our intestines release a powerful hormone called glucagon-like peptide 1, or simply GLP-1. GLP-1 travels to the brain and activates tiny button-like structures called receptors inside the hypothalamus, the body's hunger control center. And once these receptors are activated, they signal to the brain that the body no longer needs more food. And this is how GLP-1 tells the brain, "Hey, you've had enough food now. You are not hungry anymore." But the story doesn't end there. GLP-1 also slows down how quickly food leaves the stomach. As a result, we stay full for longer, and we're less likely to feel hungry again too soon. That can help reduce cravings for sugary foods and fast food. Apart from the many factors that can contribute to excess weight, such as genetics and lifestyle, for some people, another contributing factor may be that the body releases too little GLP-1 after a meal. And that means the brain may start asking for food again much too soon. These weight loss medicines are basically copycats of the natural GLP-1 hormone. In simple words, they work much like the body's natural GLP-1. The key difference is that these medicines stay active much longer than the body's natural GLP-1. As a result, they help people feel full for longer and reduce hunger between meals. Instead of having you think about snacks or fast food again just an hour later, this is how these medicines help people feel less hungry, eat fewer calories, and gain better control over frequent food cravings. But despite all the hype on social media, these medicines don't just magically melt fat away. Doctors still recommend healthier eating, movement, better sleep, and long-term lifestyle changes. Because the medicine is meant to support the journey, not replace it. Now here's something surprising. Some of today's popular weight loss medicines were actually developed for diabetes treatment, not for weight loss. But then doctors started noticing something unexpected. Patients were eating less, feeling fewer cravings, and steadily losing weight. At first, it seemed surprising. But later, scientific studies confirmed something remarkable. These medicines could help control both blood sugar and body weight at the same time. And when researchers studied the results more closely, they discovered something impressive. Many people lost around 15 to 20% of their body weight over a year, far more than what lifestyle changes alone usually achieve. But the most important change was not just the number going down on the weighing scale. For many people, even losing just 5 to 10% of body weight brought meaningful health benefits: better blood pressure, lower diabetes risk, improved sleep, and more energy for everyday life. And because of results like these, social media quickly began calling these medicines magical shortcuts to weight loss. But there's much more to the story. Let's separate the myths from the facts. Some people believe, I can keep eating junk food and the medicine will handle everything. But the reality is, these medicines can support weight loss, but healthier food choices and lifestyle changes still matter. A lot of people also think, once I start the medicine, the fat will disappear automatically. But the truth is, results are different for everyone. And if healthy habits are not maintained, weight can often return after stopping the medicine. Social media also creates a lot of confusion about side effects. Some people become extremely scared, while others believe these medicines are completely risk-free. But the truth usually lies somewhere in between. Like all medicines, they can cause side effects. But for many people, these are mild and gradually improve as the body adjusts. Although rare, serious complications can occur. That's why these medicines should be used under proper medical supervision. There's another challenge that is often overlooked. For many families, the cost of these medicines can make long-term treatment difficult. As a result, some people may stop treatment because they can no longer afford it. Behind a weight loss journey, there's often another struggle too: emotional strain, frustration, financial stress. Today, these weight loss medicines are already being used around the world. With more pharmaceutical companies working to make them more affordable and easier to access, these medicines may gradually become available to many more people. But as these medicines become more popular, it is also important to be careful. Anyone considering weight loss medicines should always consult a qualified doctor. They should avoid fake online products and unrealistic claims. They should avoid comparing themselves with influencers. Instead, they should focus on sustainable, long-term progress rather than quick results. Because even losing around 5 to 10% of body weight can create meaningful improvements in overall health. So, can medicines really help people lose weight? Yes, they can. Science shows they can help many people when used properly under medical guidance. And remember, the real goal is not just becoming thinner. The real goal is becoming healthier, feeling better, and living a better life. Think of medicine as a helping hand, not a magic wand. If you found this video helpful, consider sharing it with someone who might be confused about weight loss medicines. And subscribe for more honest and easy-to-understand health videos. Let me know in the comments, what health topic would you like me to explain in the next video? And before we end, one important reminder. This video is for educational purposes only. It is not medical advice. Always talk to your doctor or a qualified healthcare professional before starting or stopping any medication. Thanks for watching. Take care of your health. I'll see you in the next video. Until then, bye-bye for now.